during that time, I didn't really feel that it was that bad yet.
I think the coronavirus was like a wave. First, it was in China, of course.
My parents actually lived in Wuhan, China, where the virus first started. It's actually pretty crazy. I visited them over winter break in 2019. So I was probably there when the first cases were starting to arise and the government was trying to cover them up. In the beginning of January and February, when my parents were first talking about the virus, I was honestly pretty apathetic toward it, even though my parents were in lockdown. The city was shut down, public transportation was all closed, and they were really stuck in their homes. I'm really afraid, I think, of everything that's been going on and of all the people who have been dying, the hospitals that have been filling up, and just so much uncertainty that's been happening around the virus. While they were there, I was still in school, still at Williams College, just living my normal life, still attending classes, not knowing that COVID-19 would have such a great impact on me and on my school, and on the entire country of the US as a whole, and even the whole world.
Then it came to Europe. Italy was really, really bad.
I live in Italy, and my family and I live in Bergamo, which it's the city where the coronavirus, the COVID-19 hit the worst. So we would hear ambulances go by every day because we have a very, very high range of elders. It's really being at the worst place in Europe and being an Asian, we were actually a really big source of fear to them, to the Italians around us. We were scared that we would be carrying the virus as well, because back then the virus was known as the Chinese virus. We were emotionally very attacked, and we understood how they felt, but we had to be really careful. We wouldn't go out. We would try to stay home so they wouldn't feel very scared. But the emotional impact that the coronavirus had on us with being Asians in Italy was pretty sad.
In France and Spain, I think they were the worst countries from Europe. And then it came to us.
Basically, if I were to list down all the changes that has happened here in the Philippines, I would probably take an hour to say all of these. 22nd of March 2020, that's when the Philippines implemented a travel ban.
So yeah, I arrived in Singapore from Spain around March 15th, and back then Singapore only had around 150 cases with a total of 0 deaths. And however, the rest of the world was panicking, and so all expat parents in Singapore, just like mine, brought back their university children, and so it also brought back a lot more cases to the country.
When you enter the country, everyone has to download a tracking app on their phone that alerts government officials when you've left home during mandatory 2-week quarantine.
If you have relatives here or you have residency, then you can stay in your home. But if you don't, then you have to go to a government facility and pay like $100 per night for 2 weeks. So I was able to go directly from the airport to a train station from the airport, and then from that train station there was a specific van that was waiting for me that drove me directly to my grandparents' house. The quarantine process is really interesting in Korea. You are tested twice, so once in the beginning of quarantine and once in the end. There are like these health center tents that are set up in each region and each city, so I had to go there on the day after I arrived, got my COVID test, had to go through a lot of like questions, and they were asking about the different people that I met, the different places that I visited before I came to Korea. And then I was just confined to my own room in my grandparents' house, had my own bathroom as well for 2 weeks, and the government even sent me a care package full of food.
As soon as I arrived, because I arrived quite early compared to the others, I was recommended to self-quarantine for 14 days, so it wasn't mandatory then, but I still did it for safety purposes, also because I came back from Spain. However, a friend of mine who arrived just a couple days later was given a stay-at-home notice, so that's when it is mandatory, and the government will do several random checkups on you. For example, my friend had to change her WhatsApp profile picture to a picture of her in a specific place in her house. And whenever the government would FaceTime her, she had to prove that she was home by going into that same exact spot. So yeah, that was quite strict. But a month after that, the Prime Minister announced that the country would be entering 3 different types of phases to slowly get back to normal.
As COVID went by and we were quarantined, Spain proposed a 4-phase program to get back to normality.
We're a small city in kind of like central southern Canada. We have a phase 5 plan in my province, so there's things like restaurants that have recently opened up, but with 50% capacity only permitted, and a lot of people are still keeping their face masks on, and there's glass panels everywhere whenever you're talking to anybody or trying to buy something.
So as of today, we're still in phase 1, and apart from pet shops and hairdressers having opened, I don't really see a difference with the original circuit breaker, which meant that everything except supermarket, doctors, and I think very necessary shops were closed.
In that phase, big cities like Madrid and Barcelona, I'm living in Madrid, so I'll tell you now my experience, started in phase 0, which is like full quarantine. You can only go out to buy food and medicine. The government kept those big cities where most of the people live really in phase 0, phase 1, very long time.
So during the first few weeks of the enhanced community quarantine, we were required to get a quarantine pass. When going out, you are required to have your pass with you, because here in Boracay we have police officials who would check if you have a quarantine pass with you. And I think you can't enter a store or go to groceries without having a quarantine pass.
I must bring my passport or national registration identity card anywhere I go to be able to enter shops and even go grocery shopping. Well, mainly to go grocery shopping since shops aren't open. We have to wear a mask all the time, and if we are caught without wearing a mask, first-time offenders get a $300 fine, I believe.
There's been a law or a rule that has been passed that Ghanaians who are found out in public without their nose mask or their face shields or protective measures will be jailed for up to 10 years or will have to pay a fine of $1,000+.
Because Korea is so on top of their healthcare and group effort about overcoming this virus, it's kind of socially unacceptable to leave your house without a mask on.
Here we can't even go to the beach and swim, even though the beach is just a 3-minute walk from our house. And another thing is the transportation. See, cars aren't really a big thing here in the island. It's a very small island, but still big enough that you would need a tricycle or some type of transportation. So having someone ride behind you, and motorcycles are not allowed, because it was during that time that they were really trying to avoid human interaction.
Right now, there is a curfew that restricts people from going outside from 11 p.m. to 5 a.m. More and more businesses are opening up with policies that allow social distancing. Website which customer must log in and log off every time they enter a store or a mall in order to track down people. Many restaurants have to basically put tape on the chair so that they could leave some space for people to sit separately and far enough.
Also, there are buckets. There are these buckets that are called Veronica buckets, where you wash your hands for at least 20 seconds under running water. So that is set in place for people to actually protect themselves or to protect those around them.
I think in my city, precautions are still being taken, but we're not seeing as much of fear as we would have, at least initially, and also what is still there in the big cities.
But the Korean community has agreed to these measures and cooperated with public efforts to overcome COVID-19.
Different how South Korea and America have handled the virus, and South Korea has definitely taken a lot more control and been a lot more Yeah, just been a lot more responsible, I would say, in the public health sector.
And it has been at least 2 weeks without cases within the country. All cases are only from abroad. More and more people are like starting to go outside.
There was a stay-at-home order, which is a positive thing, and we were in quarantine and businesses were asked to shut down for at least 3 weeks in March and the beginning of May, but everything was taken very loosely and there wasn't a lot of respect for the whole situation.
People haven't been adhering to haven't been following the social distance protocols that have been set in place. They believe that, oh, it can't touch me, or just because they can't see it, they won't believe it.
Was in Denver at a very left-leaning liberal university surrounded by like-minded people for the most part who were very proactive about the virus, extremely concerned about taking precautions, paying attention to helping others and themselves stay safe. And I came home to Tennessee, a place that is very conservative, independently minded, and not as willing to take precautions, which was confusing when I got home because I personally find COVID to be a very pressing issue that shouldn't be ignored, and I kind of came home to a place where people still walked around without masks and went out to eat and didn't really have as much regard for respecting the power that the virus can have over people's health and over people's lives.
Virtually everybody knows about the virus, but not a lot of people are taking measures to prevent it. I know a lot of people who are doing birthday parties and engagement parties and weddings, even though they're illegal, but they're still doing it sneakily and not having music or whatever, but they're really not keeping the rules of social distancing, and that's why the situation is not getting any better in Armenia. In reverse, the cases are rising every day and hospitals are full. There's a lot of people dying, and it's because of the ignorance of the people. They don't think the virus is real because they just think it's the flu.
And I guess we could say that we really experienced the social effects of the coronavirus directly, and my father was actually tested positive with the coronavirus, and the fear that this pandemic brings in you, the fear of the possibility of losing someone you love so much, and the power it has an effect in you is really, really big. And I feel like everyone really needs to know how severe this disease is. But being on the edge of death, being on the edge of losing someone, that's been such a big part of my life. The pain that it gives you is insane.
Wherever you can, to just do your small part, because at the end of the day, it might seem small, but also collectively, if everyone does their own parts and everyone shares their knowledge and shares, even if it's just questions you don't know, you ask, but you're sharing knowledge, you're gaining knowledge, and you're trying to make a change. But I also feel like this year in general is a determining point for the rest of everything.
I feel like it's a necessary sacrifice that needs to be made.
Showed that there's always a segment of people that is in danger, especially with the virus, with the coronavirus, the elderly people, people with heart diseases, with diabetes. So you should really be thinking about those people, because you may not personally be affected by the virus, but the people around you, obviously someone will be.
As a young person in America right now, this has transformed our intentions for and our motivations for what we want to do with the rest of our lives, because we've been put into a situation in which we're forced to think about the other person, anyone else other than you, someone who's different from you, someone who's the same as you. This situation has brought people together, and I hope that going forward that will feed into the government caring more about its people, and maybe any sort of government action that will actually recognize the issues of inequality that the coronavirus has directly caused and indirectly amplified.
Just how damaging COVID-19 has been to specific groups of people, and just seeing those systems at work. Yeah, and just being really aware of those things and knowing that I can be complicit and complacent in those things, or I can actively resist those systems and institutions and really call for change